you having anxiety during oral sex? I have a theory about potentially why. I am Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist, as an ASEX certified sex therapist. A pattern that I've noticed over the years with some of my patients is, especially individuals who have experienced different types of sexual assaults or different types of traumas where things have been done to them, they notice having a really difficult time during oral sex when things are literally being done to them. It doesn't matter what kind of genitals you have, this reaction or this response can happen to anyone, where something so passively being done to you can really trigger those experiences of things being done to you in a non-consensual way, even if it's now in a consensual space. So it's not uncommon for individuals who have experienced a variety of negative experiences or traumatic experiences in their life, that if oral sex is being done to their bodies, they may notice themselves having a very anxiety provoking, or that situation might be really anxiety provoking to them. They may even notice themselves feeling tense or having a difficult time concentrating or feeling like they can't orgasm as a result. For some individuals, that action of oral sex is very passive for them. They might be laying on their back and having something being done to them. And that experience of something being done to them can be very activating because it may mirror things being done to them without their consent. So even though they might be in a situation that is fully consensual, because the action being done to them is passive, they don't really feel very often involved or incorporated. So for some individuals, we've actually found it to be very beneficial. How do we make oral sex more active engagement? So it's a little bit like active perception versus passive perception in D&D. I literally want you to roll for oral. The reason that, and the way that you might do this is, I want you to be included. I don't want something being just done to you. I want you to take your hand and I want you to have your hand be involved in the hair of the person of doing those actions to you. I want you to look down. I want you to see what is happening to your body. I want you to have your hand be connected to somewhere on your body as well. If there are fingers or digits being utilized anywhere, I want your fingers and digits to be utilized as well. For many individuals, it's not uncommon to have stress reactions or even trauma reactions to sexual activities completely consensually being done to them because it's too passive. It's too much like you're not being involved, you're not being included in the process, and that can be really activating and really triggering. So figuring out ways for you to be more actively involved, visually, auditorily, even tactilely. I want you to feel involved, so it's not just something being done to you and you're laying there passively. I want it to be something that is being done with you. If you have any additional questions about this topic or anything related to sexual or mental health, feel free to put them in the comments down below, and I'll see you next time.